Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast. It is 2026. Welcome all our listeners. Although, according to the script that Lauren gave me, it is 2025 in Congress, but we will get to that in a moment. I am here with the AMGA Public Policy All-Star Team. And why don't we introduce ourselves again, because it is a brand new year. And I need to read this word for word because Lauren told me to. Lauren has written this script and is a micromanager, and everyone must share one wish they have for themselves for the year. My wish is to reassert my leadership of this department, which has seriously waned since this podcast started. Trying to jump the gun, but
should your wish be like remotely achievable, or is it?
It's an org goal.
Yeah, it's the reach stretch goal.
But anyway, why don't we start to the left as we always do?
Hello, everyone. Licia Sawyer, Government Relations Assistant. And my one wish for this year, I don't really do wish, but I have the same resolution every year, which is to compliment more strangers. I find that when I get a compliment from a stranger, it kind of makes my day. So I like to try and do that for others.
That's very kind of you.
Yes, thank you.
Cute. Yeah. Mm-hmm. Lauren Latney, Director of Government Relations. My wish is to be more human. I feel like, we're getting less human as time goes by. So get ready for more messiness and the humanness of life. So I'm excited about that.
So will you be stirring the pot this year?
I'm going to be causing chaos in the comics.
There goes my wish then. All right.
Oh, my turn. Hi, everybody. Daryl Drevna, Senior Director of Regulatory Affairs. I guess one wish, I should have read this first to come up with something.
You didn't?
I was so focused on the next script.
You with two in the house?
Yeah. So I have two high adventure Boy Scout trips coming up. I'm going to go dog sledding. It's going to be like minus 20. And then I'm going to do a backpacking track where I'm going to do like 60 to 80 miles. And my wish is to get through that unscathed.
It's a good wish.
Yeah.
One of these, and have you asked for time off yet? I have not seen
yes.
that. Well, Lauren and I have not seen that time off.
Yeah.
So
One's in a month in January in northern Minnesota, and the other one will be till the end of June.
Okay. So Lauren
right when the fee schedule rule drops.
No way.
Go as remote as possible.
Jamie Miller, Ambassador Goodwill. For AMGA, I would say professionally and personally, I want to be more actively engaged in being a better listener. From a professional perspective, I feel like, especially the last year, we've been told a lot of things by members of Congress on both sides of the aisle, and it's been very assertive and aggressive, and I just want to listen to them and work with members of Congress to make sure that we can go towards the same goal and not be upset every time I talk to them. So,
Yeah, sounds good. All right.
Do you have
my
a
guy?
wish?
Do I? I've already expressed my wish, which is
gotta
fine.
say
That's
it
right.
again.
That's
Yeah,
right.
yeah.
That's how well he paid attention.
So that's done.
be seen. He wants to be seen,
I will think
apparently.
of I want to be heard. We started at the house where no one listens, and now it's here.
Now it's
great. My guy, you?
Probably be more creative. Just want to draw more. Get back to drawing, sketching, all that.
All right.
That was my goal for last year, but I didn't do it.
Okay.
So I'm sticking to it.
You look creative. Got your headphones on, and you got some computer and graphs and things.
Some
so.
computer. What's a
All right. Okay. All right. Well,
Yeah.
Let's moving forward. Okay.
He maths. He maths.
All right. Well, today we're going to talk about health extenders. Isn't that right?
We are.
That is right. Which is a huge issue for AMGA and the members. It is time limited in a way. I think there is a expiration date coming up very quickly. There's a lot at stake if Congress doesn't act. Telehealth doesn't get extended. Hospital home. Medicaid dish cuts, Gypsy, and other things. So this is going to be a very busy month for the team. And why don't we start with Lauren, because that's what the script says, and ask you, what are health extenders?
So it's interesting. Congress is supposed to have like one job, which is like to pass laws. And sometimes they don't do that. Sometimes they will have programs that have been expired or need to be reauthorized. And instead of like going and doing the work of like opening it back up and having hearings, talking to folks, it's sort of like, well, let's just continue to extend some of the policies that we already have. It's a lot easier that way. It's a little less controversial, but it's also not as stable as we would like. So we have these temporary extensions of these programs, including the ones that we're going to talk about a little bit more today. And they're repeated short-term patches. And as we've emphasized with Congress over and over again, having patches does not work when you're doing long-term funding and long-term projection of how your healthcare organization is supposed to work. Congress is like, cool, but the deadline is January 30th, which is what we're kind of facing again after we had a government shutdown and then there wasn't a long-term fix. And so we're back to where we were before. So that's why the title of the podcast is called Let's Do the Time Warp Again, because we're partying like it's 2025 and 2024 and spring of 23. Yeah.
I don't want to.
You can check out, but you can never leave.
Wow. All right.
You brought in 2 songs
Yes.
within 30 seconds.
Within 30 seconds.
And I know both of them.
Yeah. You got to keep it up.
Woo!
So it's sad, but here we are again. And so, yeah, we're facing our same problems that we did last year.
All right. Indeed. So what extenders are up for the January 30th deadline? We'll start with you, Lisa.
Yeah, I'll start. I think one of our biggest concerns are the telehealth flexibilities that are set to expire on the 30th. We've had telehealth originating site and geographic waivers since the COVID pandemic, so that's about 6 years. And they have become embedded in care delivery and how care is organized from the start. It's a culmination of clinical, technological, regulatory, and cultural changes. And rather than being a standalone service, it's woven into how care is planned, delivered, and followed up. And due to these waivers, patients in rural and urban areas who lack transportation can receive care from their providers within their homes. These patients value convenience, ease of access, and reduced travel. And if telehealth flexibilities expire, these patients will be unable to receive care. They either cannot or make it to their appointments, and they won't make it to their appointments. There's not really an alternative there. And telehealth supports a wide variety of conditions that these people have. It supports chronic disease management at scale, preventative care reminders and follow-ups, equity-focused outreach to rural or mobility-limited patients. It is just so critical to how healthcare is delivered now.
Yeah, agreed. And I had 2 parents with who couldn't move, and without telehealth, they'd have had actually no access to care whatsoever. Okay, thank you for that. Lauren, what else is up?
Also, the Hospital at Home program. This was a COVID created program, which basically allowed for hospital level care to be done in the home. This was a very popular program, and it expired, and then it got extended to January 30th. But it makes it hard, right? Here's a program that was like very popular. It's free for the most part, and so it's popular in Congress, but we just haven't been able to sort of see it cross a permanent finish line, which is something that we've been really emphasizing. You know, one of the things that we are hearing from our members is just like, okay, when the government shut down, you were basically, and this program expired, you took people out of their homes, put them back in a hospital, and you had a very narrow gap where the program was funded again. When you're thinking about, we are in probably one of the most brutal flu seasons that we've had in a very long time. We have measles epidemics. We have all these things going on. You want people to stay at home. You don't want to put them back in situations where you're going to have greater exposure, which is why it's important to continue to extend this program and allow sort of these programs to continue. They're popular. We're seeing it in our medical systems across the country. And also, like, how are we protecting our patient the best way we can? And this is a program that helps us that, which is why it's important it should be extended.
Absolutely. Let's see. I see an acronym. So, Daryl, I believe this is you.
My turn, right? Let's get really detailed into how Medicare pays physicians and all the various buttons and levers.
Here we go.
Yeah.
All right.
So, Gypsy, the geographic.
We have a 10-minute limit on you. Okay.
Oh, okay. We'll start the clock, and then we can revise and extend my remarks later. Extend. Yeah, the director's cut later on. Gypsy, the Geographic Practice Cost Index, and this is how Medicare adjusts physician payments based on local area cost. There are not one, not two, but three components of this. So there's the physician work, practice expense, and malpractice. Now, historically, Congress sets a floor of 1.0 for the work component, meaning no area gets penalized below that baseline. No, the issue or the problem here is Congress keeps extending this floor on a temporary basis, sometimes just for months at a time. And without that floor, some areas, particularly rural communities, would see their payments drop 7, 8, 9, 10%. For a small practice, that could have a significant negative financial ramification for it. So, rural areas, I think, are going to get hit by the hardest if they don't fix this problem. And these are the places that are already struggling to keep physicians and clinicians. And now, if the floor drops, Medicare would pay them less for the same amount of work. So this is really backwards. It's cutting payments where access is already really limited. And I think the even bigger problem is just the uncertainty surrounding this. How do you know? How do you go out and hire staff or plan for the next quarter when you're facing this cliff? Is waiting on Congress to extend this gypsy floor. Do you buy equipment? How do you plan for a physician's retirement? It basically creates this limbo situation, and it's really how low will you go?
All right. Thank you for that very concise 3.5-minute explanation. Okay. Jamie.
Medicaid DSH cut delays. The Medicaid Disproportionate Share Hospital Program. Its program's been around for years. It provides vital funding for hospitals serving large numbers of low-income and uninsured patients. That helps pay for Medicaid underpayments, uncompensated care for essential services such as trauma care, burn units, maternal care, high-risk neonatal care. And why this is important is that the Affordable Care Act passed over 15 years ago, and it basically got rid of most of it did not get rid of the uninsured. It provided the uninsured with coverage. But now, as you may have heard this summer with the OB3 bill, that increased the amount of people who don't have insurance. Also, the enhanced premium tax credit has currently expired. So there's going to be more and more uninsured people, and there's going to be more and more need for this Medicaid DSH program. The Affordable Care Act basically assumed that people are always going to have insurance. We wouldn't need the Medicaid DSH program as much, so they were going to do cuts. But that's obviously not happened because there's more uncompensated care. There's more uninsured people. And so we're trying to delay this DSH cut longer and longer. If the DSH cut would have been implemented in October, that would have been an $8 billion cut to hospital systems and integrated systems of care. So that would have been bad for everybody, not just hospitals. So that'll be a huge program that we'll be looking at in the coming weeks.
So we will work to extend the delay.
Extend the delay of cuts.
Got it. Okay, and before we move on, it was great trepidation. I asked Lauren, there's also another issue that has already expired, not on the outline, and I asked her if we could discuss it. She looked at me with just overriding disgust.
You had to grab a gigantic glass of water.
I did. It was very nervous. And I did ask Diva One if we could raise this issue on her outline. And after throwing a shoe at me, she agreed.
I missed. So that was this was a lapse on my part. I will say that.
Whoa. 14:05.
Look at this growth. I'm being human.
We're
I'm being
human.
messy. We forgot about the enhanced. Well, I forgot about adding the enhanced.
You say we. We're a team.
They're a team, but let's be honest. The enhanced ACA tax credits. This was a program that was created under the Biden administration. So there are ACA tax credits that are available. Under the Biden administration, this were enhanced to sort of expand the number of people who could have access to these reduction costs on their ACA plans. That was a huge debate that was happening in the fall, where people were seeing what were normally like $200-$300 on their health insurance plans were getting sort of notified that their plans would go up to $1,200-$1,300 a month. This was a huge conversation in Congress, but it did not go anywhere. And so if you can't get a bill done through a traditional committee process, going through the hearings, having these things sort of voted out, Congress can do something called a discharge petition, which is they need a certain number of people, 218, in order to have the votes on the floor. And that kind of bypasses a lot of this process. It bypasses the power of the speaker a lot of times. And so we saw in December, I think 9 Republicans joined their Democratic colleagues in order to sign a discharge petition to force a bill to vote on enhanced premium tax credits on the floor. That bill got riped this week, which means it had enough time. And so we're going to see a vote on that if we've not seen it already. What that looks like in the Senate, we don't know still, but we do know that there's a lot of energy behind making sure that these enhanced premium tax credits do get passed. What that looks like in reflection in terms of what's going to happen on the ground, it's still to be determined. But this conversation has not gone away. I don't think it will continue to go away, considering that a lot of focus now is going to be on affordability. What does that look like in terms of health insurance for Republicans who are trying to roll out a health insurance plan? So stay tuned as this continues to be debated. It's a difficult debate, but I think there are some people who are really focused on domestic policies who want to see this across the finish line on both sides of the aisle.
Yeah, good deal. One of our priorities. So outstanding. So we talked a little bit about the problems with the stop and start nature of extenders. How do our members get impacted by the fact that they do telehealth and they can't do telehealth? They do hospital home and they can't. There are some real life issues because of the fact that these things expire, sometimes within 60 days.
Right. I mean, it becomes to a point where people have to decide whether this is something worth continuing. I mean, like, if you're not sure about what your funding is going to look like, how you can staff folks, then it becomes a real question of what operational wise, how does this continue to work? And having that sort of conversation is really important with your members of Congress. We try to reflect as much as humanly possible what's going on the ground, but we also need to hear from you about it, because permanent decisions and permanent solutions matter when it comes to dealing with the life of people and their access to the healthcare that they're accustomed to. And so it's important for us to continue, as we always have, to stress that need to have permanent solutions or longer term solutions than what we're facing. But given the fact that it's January and this might go, we might do an extension to March, we might do it for the entire year. We just don't know yet.
Please no.
But these short-term extensions go beyond that. It's as you mentioned, the shutdown we had a couple of weeks ago. A lot of our members are like, are we going to get paid for the services we're going to do? Should we do telehealth? Can we do telehealth? Is it legal to do telehealth? Do we hold on to the claims? And those are questions that we've heard from members even before that shutdown. We heard last summer during all the Medicaid cuts, some members are like, we may not be able to do telehealth. And as Lauren and Chet and everybody who's worked on the Hill before, what happens next is there's longer wait time for providers, longer drives for patients, and then those patients contact the members of Congress. And I think there's going to be a groundswell of support for these programs.
Okay, that good. Actually, it flows in right next to Roman numeral 5, the legislative outlook for these extenders. So what is Congress considering? What are some of the challenges around the January 30th deadline? And are there any areas of bipartisan agreement or momentum anywhere on these issues? I asked the team ledge. Oh, Daryl's upset.
No. I'm waiting to hear what they have to say, because I really don't have a good answer for this.
Okay, all right.
Well, I mean, deadlines help, right? We know that things have to be done by a certain time. Usually it's going to be at the very last minute. It would have been great if Congress would have passed something this week, but we know that wasn't going to happen. Mm-hmm. So I think it's, we also have a lot of international issues that now have taken place in the country. And that also means that people are kind of distracted by a lot of things that are going on. There's always challenges about whether or not this is going to get done. I don't think it's less about whether it's going to get done. It's just going to be how long it lasts.
Okay.
And so that's always a concern. We are in a midterm election year. Congress is going to try to Hill out of here probably in the summertime. So that gives a very little time of how this is going to be determined. Are we looking at a 3 to 4 month extension or a 6 month extension? It's certainly possible. And that also makes us nervous because what does that look like for our members on the ground again?
And I think for legislative strategy, it's good to have all these programs together because there's been discussion about splitting up hospital at home with telehealth. And it's good. Telehealth costs money. Hospital home doesn't. And it's good to keep them all together. And I think we're going to hear more about the enhanced premium tax credit expirations because, as Lauren mentioned, people's premiums are going up. And people who aren't on those EPTCs are every American's insurance premiums have gone up this year.
Ours did.
And they're going to be complaining to their congressman and their congressperson a lot about this. And I think it's, it's important for us to let members of Congress understand that it's that our providers provide the best level of care that they can because there's going to be a lot of finger pointing in Congress about why these costs are going up. And we are providing the best care at the best prices we can. So I think there's going to be a lot of targets out there. We need to be careful that AMJ is not one of them.
Okay, so do we think the government will be funded and there'll be an extension, hopefully for a year, but we don't know. But will the government be funded on the 30th? I guess on 31st? Over under?
So.
Let's hope so.
That's the
Okay.
question.
Can't imagine
right?
them doing another shutdown. Like, don't you think? This is just me.
Well, the D's are talking about it, aren't
Yeah,
they?
these are talking about
Yeah,
it.
they
So-
want those PTCs and there are some Hyde Amendment issues.
Yeah.
I'm going to get into that.
But no one ever really runs in the shutdown, particularly the people who get suffered from the most, which
Yeah.
is the staffers who are working without getting paid. So I don't know if people want to do that again, but it's never out of the realm of possibility.
I guess time will tell, and that subject for another podcast, I'm sure. Okay, so we're going to close. Elisa, you and I are going to close.
All right.
And there's going to be a call to action. So why don't you go?
Sounds good to me.
I've been excluded from this section, so please.
It was a slash thing. It was a slash chip.
Well, my name was first.
Yes, it was.
Yeah. Well, the policy team, the ledge team, we're already on the Hill. We're already meeting with members of Congress across the party spectrum to ensure that patient and provider voices are heard. I'm currently running a grassroots campaign focused on these extenders and these policies. So if you're interested in participating, you can find my contact information on the Filibusters and Fine Print podcast webpage, as well as our backlog of all of our podcasts. And to stay informed and engaged, listen to our podcast. And you can work with AMGA through the District Advocacy Program, where you can meet with your congressional offices virtually or with the district staff in person in district. And our Capitol Hill Day is going to be held on June 10th. It's free for AMGA members, and it's a phenomenal opportunity to meet with your offices in person in D.C. And
You also sent out our priority letter.
And we also sent out our
This week.
priorities letter, which is highlighted in our grassroots letter. All of these things are working hand in hand and really highlight the importance of this information, as well as touching on all of these topics that we've discussed here on our podcast today.
Okay. Well, great. As I say a lot, the policy team, the ledge team is really good on the Hill. They're even better when you all work with them. So I guess with that, we will thank you. A call to action, all these things. Happy New Year. Happy 2026 to all of our listeners and to the team here. And we will see you all very soon. Thank you very much.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.